Which day is marked as World's Autism Awareness Day? Option A, 2nd April, Option B, 4th March, Option C, 1st December, Option D, 21st March. The correct answer is Option A, 2nd April. How many people are affected by autism today? Option A, about 1 in 1,000 children. Option B, about 10 in 160 children. Option C, about 1 in 160 children. Option D, about 1 in 10,000 children. The correct answer is Option C, about 1 in 160 children. According to World Health Organization, it is estimated that worldwide about 1 in 160 children has autism. How many autism cases are there in USA? Option A, more than 15 million. Option B, more than 1.5 million. Option C, 10 million. Option D, 20 million. The correct answer is Option B, more than 1.5 million. The 2nd of April is Autism Awareness Day, which recognizes and spreads awareness for the rights of people with autism. Some of you might have heard about autism. Autism is a neurodevelopmental condition, which is usually diagnosed in the first 3 years of life. Child present with delays in speech development, limited social relatedness, and restricted interests and activities. The child may avoid direct eye contact and exhibit odd behaviors, such as focusing on parts of objects. Can children outgrow autism? The answer is no. Autism is a developmental condition that affects people for the rest of their lives. Children do not outgrow autism, as they wouldn't outgrow cerebral palsy or mental retardation. However, that doesn't mean a child with autism cannot gain skills and make significant improvements. We do know that, with early diagnosis and a personalized, appropriate treatment plan, children with autism can grow up to lead meaningful, productive lives. How is autism diagnosed? The answer is there is no single medical test that can be used to diagnose autism. Autism is often diagnosed by a team of professionals with expertise in autism, based on observation of an individual's communication, behavior, and developmental levels. However, medical tests may be incorporated to rule out other possible diagnoses. Is autism a contagious disorder? The answer is no. Autism is not an illness or a disease, and it is not contagious. Autism is a lifelong disability that interferes with normal brain development and functioning, as well as social interaction, communication skills, and behaviors. What are the causes of autism? The answer is although the cause of autism is unknown, it is generally believed that etiology may be due to multiple factors. Available scientific evidence suggests that there are probably many factors that make a child more likely to have autism, including environmental, biologic, and genetic factors. How common is autism? The answer is the figures are staggering. Over the last 10 years, the number of children diagnosed with autism has increased by 200%. It is estimated that, worldwide, about 1 in every 160 children has autism, making it more prevalent than Down syndrome, pediatric AIDS, and childhood cancer. How many people are currently affected by autism? The answer is, autism is the world's fastest growing developmental disability, increasing at a rate of 10 to 17% every year. Autism affects more than 1.5 million people in the United States. What role do parents play in the diagnosis of autism? The answer is, parents are usually the first to notice unusual behaviors in their child, or their child's failure to reach appropriate developmental milestones. Some parents describe a child that seems different from birth, while others describe a child who was developing normally and then lost skills. What are some characteristics of autism that parents might observe? The answer is little or no eye-to-eye contact, no big smiles or other warm, joyful expressions by 6 months or thereafter, no back and forth sharing of sounds, smiles, or other facial expressions by 9 months or thereafter, no babbling by 12 months, no back and forth gestures, such as pointing, showing, reaching, or waving by 12 months, no words by 16 months, no two-word meaningful phrases, without imitating or repeating, by age 24 months. Any loss of speech or babbling or social skills at any age.